So I've been taking legal meth, aka Adderall, for about 4 months now, and here is my story of why I started taking it and why I stopped. I was diagnosed with ADHD. I received that diagnosis prior to my autism diagnosis several months ago, and I started taking Adderall at the suggestion of my doctor. The hope was that it would help me get my shit together, just get it all in a bag and put it together and take it to the shit store. Rick and Morty reference. But it did not do that for me. And it did a lot of other things. So I've been taking it for 4 months. I really wanted to give it a chance. And I will say the first day that I took it, I was like, oh, this is how people's brains work. This is how normal people think. It's quiet. So quiet. But that didn't last long. And after a week or so, I guess I had adjusted to it, which she did warn me would possibly happen. I was on the lowest dose, and she said we can up that dose. And I'm like, no, I just want to keep trying this and see if it, benefits, risk versus reward, benefits versus side effects. And let me tell you, the side effects were something else. It did help me focus some, but not enough to outweigh the negative side effects, which for me as a female, I do kind of want to warn people about, because it's not something you really hear a lot about. And I did watch other videos before I started taking the Adderall to kind of get some other people's perspectives on it. Most of them were men, male-bodied humans, and they did not, of course, have these issues because they do not have a uterus. One of the side effects, which it does tell you on the side effect sheet when you start taking Adderall, is that it can increase your monthly cycle issues. So if you have a lot of cramps, if you have a lot of pain with your cycle, it can actually make that worse. And for me, it made it 100 times worse. And they were pretty bad to start with, so that's saying a lot. Also, I would notice that my heart was randomly just beating really fast, like I was having an anxiety attack, but I'm just sitting on the couch watching TV, and there's absolutely no reason for it. And I know that that was an effect of the Adderall. Also, with the fibro and the other issues that I have with nerve pain, it was making my muscle tension off the charts. And again, that is another side effect that is listed in, if you read that little handout they give you with it, it does tell you that it can increase muscle tension, which is something that I brought up to my doctor, because I'm also taking Cymbalta as a fibro aid. And I said, well, I think maybe these two things are working against each other. She said, no, that technically they should work with each other. I did not see that. So for me, the benefits of taking the Adderall were minimal. But I do understand why a lot of people take it, and I do understand why a lot of people self-medicate with caffeine. And let me tell you, if you've been self-medicating with caffeine your whole life and then you start taking Adderall, you got a problem, buddy, because you got to stop drinking the coffee. Coffee actually makes it less effective, as does orange juice. So yeah, got to cut out the orange juice too. But long story short, again, the benefits that I got from it did not outweigh the side effects that I was getting from it. I have been off of it now for about 7 days. I wanted to, again, give it a full week or so before I made any kind of video discussing the differences of taking said meth versus not taking said meth. I will say the first couple of days that I was not taking it, I was grumpy. I was kind of out of it too, and not as though you're coming off an antidepressant, but it does increase norepinephrine production. So if you're not getting that boost of norepinephrine, you can probably kind of expect to be a little cranky. But thank you for joining me for my honest exploration of how Adderall worked for me. I do not think that I will be seeking out any alternatives like Vyvanse or any non-amphetamine alternatives, just because I didn't really see a huge result or a huge help in focus for me, and I'm afraid that anything I would take would probably make the muscle tension and things like that a little worse, and I don't need any help with that. So thank you for listening. If you enjoy this type of content, I'd love it if you subscribe, and I'd love it if you come back for more videos like this. Thank you for listening today, and I love you. Bye.